Yep. All right, so we'll now continue on. We've done all the CPR part of the course, and now we'll continue on with the other parts of the first aid that's required. Choking is the first one that comes up. First thing is you try and get the person to cough whatever they're choking on free if possible. Then after that you could use 5 firm back blows between the shoulder blades in an upward direction. Normally the way I show that in class would be with a mannequin, and I would suggest that if it was a person, they might sit on the chair, lean over a table, and then you can simply give them the 5 hits in the middle of the back in a forward upward direction like that. So 1, 2, 3, 4, 5. If necessary 5 to try and get air pushing up to blow whatever's in there out. If that hasn't worked, the next recommendation, and there are some ways of doing it, the way I'll show you in the video today though, is again if the person was sitting on a chair or sitting up against a wall, you put your hands in the centre of their chest, leaning against the wall, and you do 5 firm chest thrusts, similar to when you're doing CPR. So it would be 1, 2, 3, 4, 5, as such, to try and get the problem blocked out. If that doesn't work, then we usually suggest you try it all again, and then if that's not working now and the patient becomes unconscious, then that's when you would put the person onto the floor and continue trying to do CPR. Now hopefully your 30 compressions are going to cause the product to be pushed out. If you get to the point where you've done your 30 compressions and the blockage is still there, this is one time where I do recommend you would do mouth to mouth, and hopefully try and blow the blockage further down to a point where the air passages separate. And if you blow hard enough, with a bit of luck, you'll blow the blockage down, block one lung and keep the other lung free, and that should be enough then to keep the patient breathing adequately until they get to hospital. If it's a baby or a child, you can do the back blows on the baby, and because they're little, you can have them over your knee or on your hand, and you would simply do, as the picture of the board shows, 5 back blows to the back. If that didn't work, you'd flip the baby over, do your 5 chest thrusts, and you'd try alternating the 2 back blows and chest thrusts. If it's a bigger person, you have a bigger child, you may sit them on the chair and do it the similar way that I showed you there before for an adult. Okay. Yep. Then the next thing we go to is a secondary survey. When you're assessing the patient, you've done the primary survey to find out whether they're actually alive and breathing. Once you know that they are alive and breathing, then you ideally do a top-to-toe examination of the casualty, starting at the head and work your way right down through the body, and check for things like, if they're talking about neck pain, see if they've got movement in the arms and legs, check for breathing, check for whatever may be coming out of their mouth, vomit, blood or anything else. Work your way down, ask if the patient can take a deep breath. You could ask around for bystanders or the patient if they're capable of telling you exactly what happened, because that might give you some more information on what to treat. The person may wear a MediAlert device on their wrist or hang around their neck, but you don't see them all that often these days. And then a history from the casualty or the carers around would be very helpful for you to try and decide what might be wrong with the patient. Things you do for that are check their signs and symptoms. Signs are anything you see looking at the patient. That could be like bleeding, broken bones, the skin colour and so on. The symptoms are things that the patient tells you and you can't see, so that could be aches and pains, vision problems or anything, or pains they've got, anything that's a problem. They may be able to tell you they're allergic to something. It could be that they've just recently had changed medications or maybe just taken medications. There could be a relevant medical history, so they may have had heart conditions or chest pains or had maybe some other kind of medical condition such as diabetes or something. The last food and or drink that they've had could be important. On a really, really hot day, it might be that they're dehydrated. It could be that the food they've eaten has given them food poisoning or an allergy to it. And events leading up to the incident are the other thing that you would look at. So you do the patient's the head to toe check from the top right down to their feet and look for any problems. And if you go through all of those other things that I've just mentioned, that will give you a fairly good idea of what may be wrong with the patient. Shock. Shock is a fairly common thing when people are seriously injured, but the definition of shock is when a person's got inadequate circulating blood volume for some reason. That can be caused by severe bleeding, multiple fractures of major trauma, burns and skulls, someone with diarrhea and vomiting, or maybe from heat conditions such as lots of sweating, dehydration, or anywhere where they've lost lots of fluids from their body. You've got to be aware that in a child it could be worse than in an adult, so be really aware with children that if they're beginning to look as though they're shocked or having the symptoms of shock, you need to get some help fairly quickly. The signs and symptoms are basically what you see here on the board. The person could have pale, cold, clammy skin. They could be irritable and restless because they've got a lack of oxygen to the brain. They could be confused or even unconscious. They could be drowsy. Could be talking about weak muscles, shallow breathing, but it could be rapid. Their pulse will usually be weak and rapid. They may feel like they want to vomit, or maybe actually vomiting. They could be feeling thirsty because they'll be becoming dehydrated. They could feel cold, and they may need to be do something about maintaining their temperature, but it's important that you don't overheat a person suffering from shock. As I said already, the levels of consciousness could be decreased, and they could be totally unconscious or collapse on you. With infants and children, we say a couple of things to look at there. They could be very pale. They could be very unusually quiet when at this time they would normally be jumping around and being fairly active. The skin might feel clammy and cool, and they may have a mottled pattern appearing on their skin. The treatment is lay the casualty down, call for help, call 000. If possible, control any bleeding, reassure the patient, constantly keep checking their patient's condition, and if their condition is deteriorating, it's a good idea to call the ambulance back again and tell them that the condition is changing. Maintain the body temperature, but don't overheat them. You can loosen tight clothing to allow for better blood flow around the patient. Make sure they've got a good supply of oxygen available to them, and you don't give them anything nil by mouth, because otherwise that could very likely cause them to vomit. External bleeding, very simply, treat external bleeding. Wear protective equipment all the time, and whenever you're treating any casualty, you should be wearing gloves. Lay the patient down, direct pressure to the wound, so ideally some kind of dressing. Sterile dressing would be excellent, but if you don't have sterile, at least some kind of dressing, t-shirt, towel or something like that. Stop the part that's bleeding from being moved around, reassure the casualty. If need be, you might treat them for shock, and that's it. And as a last resort, you could use a tourniquet, but that has got to be an absolute last resort. And from my experience, it's very rare that you will need a tourniquet. Usually pressure is enough to stop the bleeding. Some pictures of bleeding, bit of a cut foot. If there's embedded objects in there, you would bandage around the embedded object and you wouldn't pull it out. So any kind of padding that you can put around without pressing on the embedded object would be good. Place the bandage on. You need to make sure that it's not too tight, and it could be that you need to check it later on because there may be swelling with the injury, and maybe the bandage wasn't too tight to start with, but it may become tight later on. If the bleeding persists, then you may need to put extra dressings on the top initially to try and stop the bleeding. Then if everything you've tried is failing, then maybe you need to take the first bandage off and check that it was actually put in the right place in the first place. But so pressure and padding is what you would use to stop the bleeding, and depending on the size of the injury or depending on what it is, you're going to use for bleeding. As I said, a tourniquet, last resort. If you do use one, it needs to be tight enough to cut off the bleeding. It stops the blood flow in and out of the limb, and after a long period of time that can become dangerous. So don't recommend tourniquets unless there's no other way of stopping the bleeding. If you do use one, then the time that it was applied should be written ideally on the patient somewhere. Don't remove it once it's on there, and it should never be covered over. It should be visible so that any emergency services will know that there's a tourniquet on the patient, if that's what's been done. Amputations. Simple treatment for amputations these days is to reassure the patient, stop the bleeding, treat the patient for shock, and then you would take the amputated part in a bag, keep it cool but not frozen, to the hospital with the patient. Right, keep on the on. Burns. Very simply with burns, there's 3 degrees of burns: superficial, partial thickness and full thickness, and in the old terms that was 1st degree, 2nd degree and 3rd degree. 1st degree or superficial is a minor burn, partial thickness is a bit more serious of a burn, and full thickness is when there's massive damage to the tissue. With superficial, there's usually not a lot of there is a lot of pain, I should say, because the nerve endings have been affected and the person's feeling a lot of pain. Partial thickness, there still could be pain, and maybe not a lot of pain where the serious burn is. And full thickness, often there is no pain whatsoever in the area that's burnt because the nerve endings have been totally destroyed and the person isn't feeling any more pain at the time. So the immediate thing is to cool the burn with running water for at least a minimum of 20 minutes. Remove anything that could be a problem, like rings, watches, jewellery and other things like that, because swelling might happen as a result of the burn. Anything that's non-adherent clothing and nappies should be removed if possible. Cover the burn area with a light non-stick dressing, and cling wrap is one of the things they recommend. Where possible, elevate the burns to minimise the swelling. Treat for shock and maintain body temperature, but don't overheat the patient. And if clothing is stuck to the burn area, you would cut around the clothing and leave the bit stuck to the burn still on the tissue of the person. Alright, I've already mentioned the don't remove, or I should say remove the jewellery nappies which might stick to the skin. Don't ever use lotions, ointments or creams. Water is all you use. You don't use ice or iced water. It needs to be basically room temperature type water. Don't burst blisters, that allows infection to get in. And you shouldn't use dressings that may stick to the burn. So ideally in your first aid kit, non-stick dressings would be the ones to use. Alright, urgent treatment for burns. Anyone, children or elderly people are very likely to get shock and infection. Anywhere like special areas like the hands, particularly the face, feet, genitalia, are important because when it's the face, burns could have been, flames could have gone down into the throat and done damage to the lungs or airway as well. Then burns to the mouth, that's again what I just mentioned, inhalation injuries. Alright, and it's recommended all burns in infants and children should be seen, should go to hospital for medical treatment. Head injuries, basically 2 kinds of head injuries. There's concussion, which for a long while used to be thought to be not that serious, but these days we believe that concussion can be very serious. And anyone with any degree of head injury should go to hospital and be observed for in the hospital. With concussion, the person might appear to be alright, but could have a loss of short-term memory and will often keep asking the same questions over and over again. The signs and symptoms of a head injury overall could be all the things that are on the board here: blurred vision, slurred speech, they could be aggressive and confused, may have seizures, could become unconscious or drowsy. There will be some kind of obvious wound to the head. The pupils may react differently to light if you were to shine a light in their eyes in a darkened area. They could talk about headache, nausea, vomiting, and you may see blood escaping out of the ears, nose or mouth with a clear fluid, and that's a sign of a fractured base of skull. keep it fairly quickly today. What we should say is anyone who receives a head injury and has now dramatically changed in any sort of way should be going to hospital, and ideally anyone with a fairly serious degree of head injury should go to hospital and be observed in hospital for some time afterwards. And I normally recommend as well, even days or weeks later, if people appear to be having any kind of signs of a head injury, then they need to go back to hospital to be observed, because a head injury may be very easily noticed and may occur in a big hurry, and sometimes head injuries can take a week or two, several weeks to actually become obvious. Signs and symptoms for children, the same kind of things as adults. They could lose their level of consciousness, they could become drowsy, they may be vomiting, behaving in an unusual manner, dizzy, irritable, wounds to the head, they could have headaches, and again you could see the blood escaping from the ears, nose or mouth with clear coloured fluid. And if in doubt, all head injuries, whether adult or child, should be taken to hospital to be observed by the hospital. So the treatment is call for help. If they're unconscious, you would put the casualty in a recovery position, and be aware that if the injury is something that may have caused a spinal injury, treat the person as though they've got a spinal injury and carefully put them into the recovery position. If the patient's conscious, they could be semi-reclined. Make sure you keep an eye on their airway and breathing. Record anything, particularly their conscious level, and if the level of consciousness appears to be dropping, again it's a good idea to ring the ambulance back and say their level of consciousness is changing. Control any external bleeding, and be aware that anyone with a head injury may possibly have a spinal injury. Alright, so spinal injuries, more or less already quickly mentioned things there. Anyone who talks about neck or back pain after trauma should be considered to have a spinal injury until checked by a hospital. And so the ideal thing is to not move the patient unnecessarily. They don't need to be lying on the ground. If they're sitting on a chair or something, then you leave them sitting there, but ideally you would support their head and neck. In a car accident situation, the same thing, you may support their head and neck until the ambulance arrives, and ideally tell the patient that you think they might have some soft tissue damage. Don't say, I think you've broken your neck. The treatment for spinal injury is, I've already mentioned it, yep, all of those things. And the log roll, if there's people available to help you do the log roll. Sprains and strains, common injury to people is strains and sprains. The signs and symptoms is usually pain, a bit of tenderness when they try to put pressure on the ankle or wherever the sprain may have been. There could be swelling, bruising and discoloration. We're told that children's ligaments are stronger than adults, and forces that would tend to cause a sprain in an adult may cause a fracture in a child. So again, if in doubt as to the patient's condition, it's always better to get them to a hospital or doctor for a second opinion. The treatment for sprains and strains is the word ricer, and they say rest the patient and get the casualty to stop and rest and don't move around. Apply an ice pack to the pain area for the pain and to reduce the swelling. A compression bandage, which is normally a brown coloured stretchy bandage in your first aid kit, and you would apply that firmly, or these days a modern snakebite bandage is also good for compression on a sprain or strain. Elevate the area if possible and refer the casualty to appropriate medical professional. Dislocations, quite simple. The bit on the bottom is the important thing. Do not replace a dislocation. Anyone who you believe may have dislocated something, a shoulder, a finger, knees, ankles, whatever, they should be just kept in a comfortable position, call for help, and that's about all you can do. And don't ever try to put it back in, because you could do more serious damage when you put it back in. A couple of horrible dislocations there for you to look at. And fractures, fairly similar thing with fractures. If a person's got an obvious broken bone, they could have pain, deformity, bruising, swelling, reduced mobility, crepitus, all the things you see mentioned there. A child may not like you to touch their limb because it hurts when you do, so they may be panicky about that. Ideally, the initial treatment ought to be call for help, control any bleeding if there is any, and support the patient in the most comfortable position. And if you're going to be waiting for the ambulance, then there's probably no need to particularly do any stings and bandaging at this stage, because just supporting them in a comfortable position till help arrives is the best thing to do. Okay. Most common places that fractures happen are the things you see over there: the jaw, collarbone, upper arm, and so on, right down to the toes. And in children, it's usually the lower arm, the wrist, the elbow, and so on. Slings, we will show you how to do some slings later on. Yeah, in your practical session, we will show you how to do the slings if you require to use them. They're the three most common types of slings to be used in first aid. Otherwise, any other way that you can support the injury comfortably is adequate. So, for instance, pulling up a shirt, putting a pillow under the person's arm, or supporting the arm, and really that's all you need to do until the ambulance arrives. Asthma. When a person has an asthma attack, the air passages swell up, mucus gets excluded into the airways and makes it difficult for air to get in and out of the patient. Things that cause asthma are the kind of things you see on the board up here now: the exercise, allergens, infections, all of those sort of things. If a patient is a known asthmatic and then they say to you that they're having a bad asthma attack today, then the treatment would be to, as soon as possible, get the Ventolin to try and fix their asthma problems. These days too, thunderstorm asthma is another possibility, and if a person is having what appears to be an asthma attack, but they're not a known asthmatic and the weather conditions are such that there's thunder and lightning around, it may be that you can treat that person as well as an asthmatic. The signs of asthma attack are usually shortness of breath, wheezing, chest tightness, a bit of a permanent cough. They could be tired, distressed, difficulty speaking, pale skin, sweating, and blueness of the lips. And and in little children, it could be abdominal recession. You could see the abdomen sucking in when they're trying to take a breath, and you may see sucking going on around the neck. A person who's having a serious asthma attack might have great difficulty in speaking a full sentence. So they often might want to say, "I'm having a bad asthma attack," and they'll be going, "I'm having a bad asthma attack." If that person's speaking that way, that is serious, and I would be trying to get help on the way straight away, and then proceed with the treatment for asthma. The asthma management, there is in schools, there's an asthma record that could be filled out with all the details of the child, what causes their asthma, what's recommended and how to treat them. And very shortly I'll show you how to use a spacer for a person having an asthma attack. Asthma medications, there's salbutamol or Ventolin in a blue coloured container. It may be a slightly different coloured blue, but generally blue means it's a spacer. Or it could be Bricanol, which is a turbohaler, and you can use that without a spacer. When it comes to first aid, there's a thing called the 4x4 plan, which has been developed to help you remember how to do first aid for asthma. And ideally with that, we get the patient that's having the asthma attack, sit them up, calm them and reassure them. Then in a moment I'll show you with the spacers that you would give them 4 puffs into the spacer. So you give 1 puff and then the person takes 4 breaths. Then they take another puff of the spacer and 4 breaths, and you continue that 4 times. Then they say you wait 4 minutes. If the patient isn't getting any better, then you would be calling an ambulance and continue doing the 4x4 plan until the ambulance arrives. Alright, so now I'll show you how to use the spacer. Back to there. To use a spacer, ideally, it's been proven that just using Ventolin in a person's mouth isn't as good as a spacer. So ideally what you need to do is shake the Ventolin, pull out the container and check that the use by date, that it's still in date and can be used, and you've shaken it. Then the spacer can be various different sizes. This particular one I've got is this one. You put the Ventolin into the end where that'll fit, and the person can then take one puff of that and 4 breaths. So that would be going. Then another puff and 4 breaths. You continue that 4 times. For little children, it may be that they find it hard to use that. You might have a mask that can go over that, and that can go over the patient's face and nose for them. And it's the same treatment though, it's 1 puff and 4 breaths. You continue that until the ambulance arrives, or until the patient starts to breathe appropriately again and say that they're feeling fine. But ideally, if you've got the ambulance on the way, you keep going on that. If the person gets to the point where they've maybe had too much Ventolin, they might start to shake, and they could stop for a little while and assess their breathing. If you believe they're breathing adequately, that's fine, but otherwise you continue with the 4x4 plan until the ambulance arrives. All right, we'll go on to anaphylaxis. So anaphylaxis, years ago wasn't very common, but these days it is a fairly common thing. It can be caused by all sorts of problems such as bee stings and allergies to food, and almost anything could possibly cause an anaphylaxis in a person. They're the most common things that could cause anaphylaxis. There's the bites and stings, there's the food products, medications can cause it, and some people, latex can cause it. So latex gloves are not a highly recommended thing in your first aid kit. If possible, you should always be using blue coloured gloves, which are nitrile gloves, and there's been no known allergies to nitrile gloves at the moment. Signs and symptoms of anaphylaxis are, as you see there, they could have trouble breathing, their tongue could swell up, which is a common thing. There could be swelling and feel tightness in their throat. Their voice could start to be difficult to understand, and they could start to get a hoarse voice. They could be wheezing and have a persistent cough, could become dizzy and collapse, and the little children, little babies, they'll just go like a rag doll and become totally floppy. Generally speaking, if a person knows their anaphylaxis, then there won't be a problem. As soon as they say they're starting to have an anaphylactic reaction, you'll know that the EpiPen is the thing that is needed in a hurry. If it's someone that's never been diagnosed with anaphylaxis, then what you need is an EpiPen, and there may not be one of those available. More signs and symptoms, showing you how the lips swell up. There could be patches all over the patient's body as well. There you go, more pictures. The way to treat it is with an adrenaline auto-injector, and anybody in a school situation will have an action plan by ASCIA. On that action plan there'll be a picture of the child, what they're allergic to. It will tell you how to treat it if it's a mild reaction, and if it's only a mild reaction, they might recommend other types of treatment. If it becomes a serious reaction though, then and it's anaphylaxis causing the problem, then the EpiPen will be what's required. And the anaphylaxis action plan there tells you step by step how to treat the patient. It's most important, they've found in recent years, that the longer a person stands upright, the worse the anaphylaxis could get. And therefore, as soon as a person starts to have reactions to anaphylaxis, they should be laying down or at least sitting down, and help should be brought to them. And you shouldn't be walking the patient to get help. The action plan for anaphylaxis is this: it's to lay the person flat, don't let them walk around. If they're unconscious, they've got to be in a recovery position. If their breathing is difficult, you allow them to sit, but otherwise lying down is the best way to go. Then you'll need the EpiPen. EpiPens come in 2 sizes, an adult EpiPen and a junior EpiPen. You'll be calling for the ambulance, let the family know, get the EpiPen ready to use. With the EpiPen, the needle comes out the orange end, and people have been known to, in a panic, use it incorrectly, put their thumb over the orange end. When they press the button, the needle goes into their thumb, and then it can't be used on the patient. What you've got to do with the EpiPen, the blue cap on top is a safety cap. While that's on, the EpiPen won't work on anybody. Take the blue cap off, and it's now triggered and ready to go. And a little rhyme has been developed to help you remember how to use it. The blue goes to the sky, and the orange goes to the thigh. So when you're going to give a person a shot with an EpiPen, it's take the cap off, hold it in your hand like that, then you put it into the person's thigh. Ideally make sure there's nothing in the thigh like keys, wallets, telephones and things like that. The outer third of the thigh, and you push it, goes click, and you go 1, 2, 3. 3 seconds, and then you take it out. The orange bit slides over the needle so that you can't accidentally stab yourself. And then if need be, after 5 minutes, if the patient hasn't got any better, you could use a second one, and normally they come, people buy them in 2s, so there are normally 2 available, and that's it. So if need be, after 5 minutes, another shot. Seizures. There are many different types of epileptic seizures, but in first aid classes we normally only talk about 2 types, and that's a major epileptic fit and a febrile convulsion in children. But quite often epileptic fits do cause other problems, with such as things like people falling off of heights and ladders and stuff. Car accidents are often caused by someone that has an epileptic fit while they're driving. So when you're assessing a patient with injuries, one of the questions you should be asking is, what caused the problem, and maybe are they an epileptic? So the other things with epilepsy can be epilepsy itself, but it could be as a result of a head injury, a stroke, hypoglycemia, drugs, poisons. Lots of things could cause a seizure. Generally speaking, if you know the person is an epileptic and it's common for them to have a fit, then you would let them continue fitting until they stop, roll them onto their side, ensure their airway's clear, let them recover and see what they'd like to do. However, if it's believed, if that person's having a fit after any one of these other things, it should be a call the ambulance straight away job. And the febrile convulsions with children, it's the same thing. You should be calling an ambulance straight away if that's it. The treatment, it's call for help. Make sure they're in a safe environment, can't hurt themselves anymore. If they're bashing their head on the concrete, you can sometimes just stick your foot under their head so that they're bashing their head on your foot, which is a bit softer than the concrete floor. Once they've stopped fitting, you should consider use empathy and think, if you were the patient, how would you like to be treated? You might get rid of the crowd that's standing around. You could cover them up with a blanket or something like that if they've lost control of their bladder. Don't restrain the person. You can stop them from injuring themselves, but you can't hold them down, because that could even cause them to break their own bones while they're having a fit. You don't stick anything in their mouth. In years gone by, people would try and grab their tongue and things like that. You don't do any of that. You just let them continue fitting, and once they've stopped fitting, then you can do something about clearing their airway. Try and record when they started fitting and when they finished, and normally a person should have a fit, shouldn't last very long. If the fits last longer than 5 minutes, you should certainly be calling an ambulance. And if the fits continue in and out, if they go in and out of fits, then you should be calling an ambulance. If it's a pregnant woman, you definitely call an ambulance, because the mother and baby need to be checked. And it's also possible for a serious medical condition called eclampsia, and one of the signs of that can be the person will have what looks like an epileptic fit. Once the person stops fitting, you could stay with them, reassure them until they're fully recovered and decide what they want to do, and that's about it. Then when it comes to febrile convulsions are usually caused because the baby might have got an infection or something and they've now got overheated, and the baby will usually go very stiff looking in bed, their head right back, looks pretty terrible. Ideally what you need to do for those is make sure they don't get injured in any other way, and at least maybe move them to a cooler location. All right, then heart attacks. Next thing, a couple of things with heart attacks. There is a heart condition called angina, and people with angina have usually been diagnosed with a heart condition already. Then after they do too much physical activity or get a bit overexcited about things, that might put pressure on the heart, and they'll start to get pain in the chest and difficult and feel uncomfortable. With those people, they normally have their own medications which you could give them, and generally if you give them that within 5 to 10 minutes, they should be far better, and if need be, you still call an ambulance. But lots of other things can cause a heart attack, and the major cause of a real heart attack is a blocked artery, and that stops blood flow to parts of the heart muscle and starts to do damage to the muscle and can cause a lot of problems with the patient. Potential signs and symptoms of a patient having a heart attack could be pain or discomfort in the chest. They often say they feel like someone's sitting on their chest, they can't breathe. Pain may radiate down into the neck, arm, shoulder, back and so on. Could be difficulty breathing. They could feel like they want to vomit. Often they may sweat and be really soaking wet. The skin could go very pale and grey looking. They may have a feeling that they're about to die. And one of the bad things is they may say that they need to use a toilet. If possible, you'd recommend they don't. They just hang on until the ambulance arrives. And you need to get an ambulance as soon as possible. The treatment is get help, rest the patient and reassure them, and the calmer you can keep the patient, the better. Assist them with their medications if they have medications of any type, loosen their clothing so that they get a good flow of blood around them, reassure them. And one of the new treatments these days is if you have dispersible aspirin, you can give them a 300 milligram aspirin, which can help to improve the circulation to the person's heart and possibly be a very important thing to do. So dispersible aspirins are allowed to be in your first aid kit and are recommended for someone who believes is having a heart attack. The other thing is you could be prepared that you might have to do CPR if it gets worse. Stroke. When it comes to stroke, two kinds of things happen with the stroke. You could have a blockage to a blood vessel in the brain, or you could have a bleed happening in part of the brain. Either one will reduce the amount of oxygen getting to that part of the brain. So the signs and symptoms of a stroke are they could have a flushed face, maybe loss of movement, and they could feel paralysed down one side. They may have headaches, might have trouble swallowing, could have slurred speech. Their level of consciousness could be altered, they could be unconscious. Pupils may be different if you were to check their pupils. Pulse is often rapid and pounding. One side of their face may be paralysed. They could just look and feel very ill, and they could feel nausea and vomiting. And depending on what part of the brain is affected, is where you will see something showing up as a result of the stroke. So often their vision can be affected as well. Stroke Foundation's created a thing called FAST, and they say when you believe someone's having a stroke, you should think fast. Look at their face and see if there's any problems there. Their arms, they could have weakness in one arm compared to the other. Their speech may be totally confused or slurred or affected in some way. And the T is time to act fast to get help. Call 000, regardless of how brief or if the symptoms have been resolved. Some people can have a thing called a TIA, a transient ischemic attack, and that's a mini stroke, and by the time the ambulance gets there, the patient's normally back to normal, but they still need to go to hospital and be checked. The other things you do is reassure the patient, reduce the looser clothing, let the blood flow better. Don't overheat the patient and just maintain their temperature. Semi-sitting is the best position, and ideally don't lay them down. If they become unconscious, then you've got to put them in the recovery position and make sure their airway's clear. And above everything else, make sure that their airway is clear and they're able to breathe. Poisoning, very simple. With poisoning, you can get poison into your body by ingesting it, inhaling it, absorbing it, or injecting it. As it says over to the side there, it only takes a small amount of the substance to make children very unwell. And normal doses of prescription things for adults could be very serious with children. There are an endless amount of signs and symptoms you might see when a person has been poisoned. So if the history is that they may have been poisoned, these are the things you could look for. If it's ingested, you might see all of those things that are mentioned there. Looking and feeling unwell, nausea, vomiting, abdo pains and so on. If it's inhaled, you may have breathing difficulties, they could be unconscious. There could be burns around their face if it's due to burning. If it's injected, you might see where the injection's gone in, and for instance when a snake bites you, there could be a scratch or a cut on the arm or leg wherever the bite may have happened. And if it's absorbed, you could see the red or burst skin or other poisoning signs and symptoms. The recommended treatment is to call help if you believe 000 if it's serious. Treat any life-threatening conditions, so make sure the airway's clear when they're breathing. Try and figure out what they've taken and how much of it. Don't make the patient vomit. And if the vomit occurs, it's a good idea to try and save the vomit if you can. Take it to the hospital for them to look at. As it says there, if you're going to do CPR, then make sure you use the mouth or some kind of mouth mask or some kind of protection, or else just do hands only CPR. And the number that's worth knowing about is the Poisons Information Centre. They are brilliant, they answer the phone extremely quickly, and they can tell you all the information about virtually any kind of product, plant, animal or medications that the person may have been poisoned by, and they will recommend to you what's the recommended treatment for that particular thing. So 13 11 26, that's the number. Alright, we're up to snake bite. When a snake bites you, it's generally on the legs, but it could be on the hands or anywhere else. There may be 1 or 2 holes, depending on whether they've got 1 or 2 fangs left in their mouth. Depending on what snake gets you, there could be all sorts of different signs and symptoms. So hopefully when you get bitten by a snake, you'll know a snake bit you, and you won't have to be worrying about anything else. It'll be straight to hospital to get some treatment, and you'll use a pressure and mobilisation bandage if you can, which I'll show you about shortly. There are people around who've been bitten by snakes and didn't know about it, and if that happens to be you, then it could be several hours later that you suddenly become a bit ill for no known reason. If the history is that you could have been bitten by a snake, you should be having a look at your foot, leg, and maybe you'll find a wound there that will show you that you've actually been bitten by a snake. The treatment is cough 000, lay the patient down and keep them still. The more you move around and the more you panic, the quicker the poison will travel. Use a pressure mobilisation bandage to the affected limb, and that would be a brown stretchy coloured bandage that may be in your first aid kit, but it's advisable that you should go and buy special snake bite bandages which have got a pattern on them to allow you to learn how to put it on effectively and at the right tension, and they would be ideal to have in your first aid kit. Then you would split the affected limb and immobilise the casualty if possible. A couple of things you don't do. You don't wash the bite site, because what the hospital wants to do later on is check the bite area, see if there's actually any poison there, and if there is, then they can detect what kind of snake it was that you've been bitten by. And in Australia, about 3,000 people a year get bitten by snakes, and on average about 2 die, and maybe 500 have a bad result from being bitten. So a lot of people get what's called a dry bite, and they actually haven't been envenomated at all. You don't try and catch a snake, you don't cut the bite site, you don't suck the venom out, and ideally don't move the patient around unless there's some danger to them, and you don't apply a tourniquet to the limb that they've been bitten on. Righto, we'll go through the bites and stings chart, and then I'll get around to show you how to do a pressure mobilisation bandage. So pressure bandage, you use it for all snake bites, funnel web and mouse spider bites. You use it for cone shells, which are generally found in the Queensland part of the area, blue-ringed octopuses, which are all around Australia, and pressure mobilisation bandage is what you would use. Then vinegar is recommended up in Queensland on the box jellyfish or the Urugansi, or any tropical stings of an unknown origin. Vinegar is what's recommended that you would use there, and you'd flush the area with vinegar to try and get the tentacles of the jellyfish off the body, and also to ease the pain. Then heat therapy. They recommend heat therapy should be used for blue bottle jellyfish, for stingrays, and for any spiny fish that might stick a spike into you. Cold therapy is used for redback spider bite, ants, wasps, bees, and centipedes is what we recommend for cold therapy to be used for. Alright, so then we better show you how to do the pressure mobilisation bandage. You filming that or you? Pressure mobilisation bandage. I will show you how to do it on Henry. Hope we will. There are a couple of different ways of doing it. One simple way is that you can put a pad on the bite area where the bite was, and then bandage over that to keep the pad on in place. You then go to the bottom of the limb, probably take the watch off on the way, but we won't today, and then you firmly pull the bandage on. The snake bite bandages, which I recommended before, and this is one of them, has rectangular patterns on them, and when you pull the bandage at the appropriate tightness for a snake bite bandage, they will become a square. Alright, so then you bandage the entire limb and pull the bandage appropriately so that they become a square. Like that. And you bandage the entire limb. Usually it'll be a leg, but it's easier to demo on an arm today. Alright, so then you bandage the entire limb, and the person so once you bandage the entire limb of the patient, that could be strapped to the side of the patient to stop it moving around. If it's legs, yep, so that could be strapped to the side of the patient using a triangular bandage, for instance, like so, and immobilise it. If it was a leg, you'd lay the patient down and you could tie a couple of triangular bandages around the legs, so the good leg to the bad leg, to stop it moving. Reassure the patient, tell them that the more calm they are, the better it'll be, and off to hospital. Then what happens in hospital, they will open up the bandage, depending on which way you've been taught, but they will open it up, they'll remove the pad that was in there, and that allows them to leave the bandage on. Ideally you'd use a littler pad, but this is what I had. Then they can test that pad, say what kind of snake it was and how strong the poison was, or they might say there's no poison there at all, so you've had a dry bite and you haven't been envenomated at all. But if it's they identify it, say it's a tiger snake, then they can get the anti-venom ready for you, then they can remove the bandage and then treat you from then with what goes on. All right. Fingers. Alright, I'll quickly show you now how to do 3 different sorts of slings. In fact, I'll start with this one. While it's in a narrow shape, ideally you point one end of the bandage away from yourself, one end of the bandage towards yourself, pick up the 2 loops like that. The person's hand can go in there. You can then tighten that up, and that can then be tied around the patient's neck. Like so. And so that can be, that's one type of sling, and that'll support the person's arm in that position if that's where you needed it, depending on their injury. next kind of sling, you need to have the triangular bandage totally unwrapped. And to keep it simple, I always talk about the pointy end of the bandage, just the pointy end. It always goes to the elbow. So with a person like this, if we're going to put a bandage on, that goes on over the shoulder like so, pointy ends to the elbow, that bit comes up there. Then you can tie it off again with your knot there. Here you've got two choices. You can do the old-fashioned English way and fold that up with a nice square edge and put a pin in it and make it look pretty. Or you can do the Aussie style, twist it around a bit like that and stick it in there, and that works just as well. All right, then I'll show you the last sling. So with this kind of sling, we want the person's arm up there like that. The pointy end again goes to the elbow, and this time it goes over the patient like that. Pointy ends in the elbow area somewhere. Then up here, give it a couple of twists around the person's hand, just to lock their fingers in. The other end of the bandage comes up underneath like so. And you tie it off. And then we go back to this end again, and it's the same old thing. You can do the pretty folded up with a square edge and a pin, or you can give it a little twist around like that and tuck it in. And then that allows you to, up here you can feel the pulse if need be, and you can tuck it all in to make it pretty everywhere else. Okay, so they're the three most common types of slings, and otherwise anything that works can be used. So you can undo a button, shove your hand inside your shirt. You could pull a t-shirt up and pin it up there, and that could be another type. All right, and then roller bandage.
Yeah,
All right, just a roller bandage to show you how to use a roller bandage. To start out with, it's called a roller bandage. So I'm going to bandage his other arm because we're going to work on it. If you're going to put a bandage on, maybe to hold a dressing on, you would bandage over the dressing. The important thing is don't pull it too tight. It's got to be firm enough to hold the dressing. If it was a sprain or a strain, you'd use a stretchy one so it would be a little bit tighter. And then you just roll it on like so. When I use a roller bandage, normally if it's a hand I'm bandaging, I'd normally leave the thumb out if possible. So he might have cut his hand, I'd put a pad there, bandage it on like that. But I'd leave the thumb out because that's handy for opening the door and anything like that, where you need your finger to help. Otherwise, a roller bandage should just roll on, and like I say, it should be firm, but not too tight. When you're finished, you press down on the patient's fingernails, and they should go white. When you let go, if the colour comes back, you know the bandage isn't too tight. If the colour is very, very slow coming back, the bandage is probably too tight, and the person will start complaining about their arm aching. All right, so then that's it. You covered about 2/3 of the bandage each time you go, and that's it. You would normally cut the bandage and tape it up to finish it off. And what I sometimes do, particularly in class, is just tuck it under there like that, and that works just as well. If it was a bleed, you'd probably try to elevate it, maybe put it in a sling, instead of just letting it hang around. Anything else? Like we got it. And that's my final thing on first aid, is if in doubt, always call an ambulance. All right, so thank you, and hopefully we'll see you here for practical.